Hi, my name is Amanda. I'm the Clinical Education Manager for Health Exchange Pharmacy. I'm also one of the trainers for the Obagi Nu-Derm range, and I'm going to do a short demonstration video on how to apply all of the products within the NuDerm system. Now, the NuDerm system is quite commonly used for treatment of pigmentation disorders, such as melasma, cholasma, post-inflammatory hyperpigmentation, and it's also used in combination for acne patients who may suffer with post-inflammatory hyperpigmentation and acne. So I'm going to do a really short demonstration on how you apply the products so that hopefully you've got a better knowledge of how to apply them at home. So I'm just going to do a very short demonstration video on how to apply the NuDerm system onto the skin. So it is a morning and an evening routine. There is 7 products that come within the box. The 2 things that you need to decide when you're ordering your system is, do you want a normal to dry system or do you want a normal to oily system? Now, me and Patricia already had a chat and she said that her skin is a little bit on the drier side. So I've opted for the NuDerm normal to dry system, and the products that I'll be demonstrating are the arbutin range, the non-prescription range of products. So you'll see on the box, it says NuDerm Fx. That's because it is the arbutin 7% that is in this box. So I'm just going to give Patricia's skin a quick cleanse. I'm going to use firstly the Gentle Cleanser. It's a really good product for removing makeup. Even eye makeup, mascara will come off with the cleanser. So I'm going to apply a generous amount onto my gloves. And then I'm going to rub this onto Patricia's skin. So I'm just making sure that I've given her skin a really thorough cleanse, because the problem is if you don't cleanse the skin well, they won't get a penetration of the products. And actually what we do a lot with Obagi is talk about product penetration into the skin. So I'm just going to use some gauze. Just to clean the skin with. So I'm just making sure that I have got all of the makeup off the skin here. And this can sometimes take a couple of wipes, so just make sure. So once the skin is clean, you're actually going to use your NuDerm toner, your step 2. This is a morning and an evening product, the same as the cleanser. And I'm actually just going to pour a small amount onto some gauze here. So small amount onto some gauze, and I'm just going to wipe it all over the skin. Now, the whole purpose of the toner is to make sure that the skin is the correct pH so that the hydroquinone can penetrate well into the skin. So hydroquinone oxidizes very, very easily, as does arbutin. So if we don't do the toner step, we may be affecting the product penetration. So for this video, I'm using the non-prescription range, the arbutin. However, the whole purpose of the toner is to allow the product, the pigment suppression product, to get into the skin. So I'm just cleaning. So that is my step 2 applied. Step 3 is my pigment suppression product. So this is an arbutin product. It's for a morning and evening application, and I'm going to show you the amount that we use to measure. So when we're treating using this product, we're going to use a 0.5 gram measurement, which is a fingertip amount, or it's the O to the A on the Obagi bottle. So you can see there it's a 0.5 gram measurement because it's the O to the A on the Obagi bottle. So I know I've now measured 0.5 gram. And everything after step 2 doesn't wash off the skin. It's just to be applied on like a cream and then left to soak into the skin. So I'm making sure that I've applied all the product off my gloves onto Patricia's skin. Then I'm going to do number 4. This is my exfoliating product. So this one is called Exfoderm. This one contains phytic acid, so it's a very mild acid, 3% phytic acid. And again, it's a cream formulation. So this is your exfoliation product. This is going to remove any dead skin cells from the stratum corneum. But again, a very mild acid, but really good for breaking down those dead corneocytes which can remain on the skin surface. So I'm going to do a small measurement. Again, O to the A on the bottle, so 1/2 gram. We always want to do 1/2 gram dosages. And then I'm going to apply this all over Patricia's skin. Again, making sure that I've covered all the areas. If you're treating necks, you can once a week drag this product down onto the neck. So that is our number 4 step. Number 5 step in the routine is your hydrate. I'm going to put some hydrate on. Just 1 pump or as much as you feel you need. This one can be used multiple times if needed. So you can do more than a once and twice a day application of this. If your skin feels dry, you can use it as many times as you like during the day. So again, I'm just applying all over. So the final step after your hydrate is your SPF protection. So this is a chemical and a physical SPF 50, and it's called Sunshield Matte. It's the one that comes in all of our Obagi systems. So I'm going to get a generous amount. I'm going to apply it onto Patricia's skin. Go. So I've just applied a generous amount all onto her skin just to make sure that she is protected. For the evening routine, we're going to do some of the same steps. We're going to start off with the cleanser, then we're going to do the toner, then we're going to apply the Arbutin product, 1/2 gram, again 1/2 gram measurement of the Arbutin number 3 Clear FX. And then finally, you're going to miss the number 4 step, so that one doesn't come into the evening routine. We're going to do 1/2 gram of the blender mixed together with your vitamin A product. So that can either be your non-prescription item, your retinol, or your prescription tretinoin, and 1/2 gram measurement of each. You can then reapply the hydrate if you want to, and the hydrate can be as many times a day as you need to, especially if the skin feels dry. You can just reapply this product throughout the day. And that is the whole NuDerm FX system and how to apply it onto the skin.